COVID-19 pandemic has affected human health and the healthcare system. In some cases, it led to violence, stigma and discrimination against suspected cases, largely because of information gaps. Research done by School of Public Health shows that there are several communication gaps, especially to families and host communities, where patients have been in treatment and isolation centers.
Stigmatization of patients as well as their contacts was indeed evident in several communities, and they faced a number of challenges, as I've already indicated, rejection not only from the community but also from their own families. And because they were perceived to be a problem, you can you can infect families. So that was part of the thing that we looked at, and this was mainly attributed to limited awareness as well as misinformation about the facts of spread, the facts of infection. Therefore, effective communication is actually critical in ensuring that the pandemic is controlled and averted in a sustained fashion.
The study, funded by Government of Uganda through Makerere Research and Innovation Fund, was done in the districts of Kampala, Wakiso, Tororo, Gulu and Luwero. The research found out a slightly higher proportion of COVID-19 survivors that exhibited moderate and high stress compared to quarantined persons.
Be declared COVID-free to the community so that they can thrive within their community. Finally, a continuous follow-up at the community level on how to manage all forms of stigma, and being reminded that having been declared free does not guarantee not getting reinfection. So be reminded to always continue to observe the SOP.
The study also revealed that COVID-19 survivors felt that there was unclear information on their COVID-19 status and on how they were reached out to.
Many of the people you find in quarantine cases were in confusion, and this kind of confusion is what helped even to propagate the stigma, because stigma relies mostly on lack of information, lack of transparency. Involvement of communities in identifying proper channels for communication should be very important for us to deal with this stigma. We need to identify correct avenues that we can utilize, especially those that have been found by this study to be channels that are more reliably taken up by the communities.
Zahara Abigaba, UBC.